Hello, good morning. This morning I was visited by a couple who brought their 6-year-old daughter along with them for an eye checkup, and to their utter surprise they found that the girl could read only 2 lines of the Snellen's chart in right eye and could read 6 by 6 or the entire chart with the other. Now this was a very disturbing discovery for them, but ladies and gentlemen, you can prevent your child from having this kind of a situation, and this situation is called a lazy eye. Lazy eye or amblyopia develops when there is a difference in the refractive error or the refractive status between the two eyes. The better eye suppresses the eye which has got a larger refractive error, and this situation is called amblyopia and commonly is known as lazy eye. Now, every cloud has a silver lining, and the best part about this couple was that their child was only 6 years old, and where there is hope that the eye will catch up with the normal eye, the eye which is suppressing the other eye, in due course by use of corrective glasses and selective patching of the normal eye. This brings us to a very important point of discussion, that an annual complete eye checkup is essential for children. And I think when the child enters school, it is very important that a complete eye checkup be carried out by a trained optometrist, or still better, an ophthalmologist. When the child is in preschool age, it becomes a challenge to assess vision of the two eyes, because the child is still learning alphabets, and whatever specialized tests we have are not accurate enough to exactly find out what the refractive status of the child is in terms of his or her vision. And that is the time when we have to do an objective refraction. We have to put cycloplegic drops or ointment in the eyes and try to get the basic refraction of the eye. Amblyopia affects one eye, and it sometimes leads to an irreversible lowering of vision. We also call it not one-eyed blindness, but the person is practically relying more on one eye. It is possible to reverse this. It is possible for the eye to catch up till a certain age, and it is normally accepted that 6 years of age is an ideal time, but we have seen recoveries happening till 8 years of age or a little beyond also. So it is important to conclude that the earliest it is diagnosed, the better it is for the patient to improve to normal. Now there are certain telltale signs which a child may be displaying, leading to some suspicion that the child is having a refractive error, or maybe the refractive error in one eye is more than the other eye. Commonly you will see children going too close to television to watch their favorite TV programs, and if you take them away from the television, they feel uncomfortable, they'll cry, they will try to grow closer. Now that can be a broad hint. Then there are children who would probably make a certain posture, head posture, while watching television. It can be just a turn or a tilt or a combination of two, and they are preferentially using one eye at a time while doing near work or while watching television. Now that can be a starting point for suspicion of a refractive error, and maybe it's the right time for the parents to take the child for a complete eye checkup.